the bite of an infected female Anopheles mosquito. Travels into your liver, multiplies for a few days, and then enters your blood cells. Hello everyone, welcome back to another episode of the Dhanvantari Podcast. I'm Trisha.
And I'm Kshithij. We're here once again to break down health topics in simple, easy to understand language, helping you understand what's really happening inside your body.
Today's topic is something that's been around for centuries and still affects millions every year, and it is completely preventable with the right care. Malaria.
Let's start from the basics. Malaria is an infectious disease caused by Plasmodium parasites. These parasites enter the human body through the bite of an infected female Anopheles mosquito.
Exactly. When that mosquito bites you, it injects the parasite into your bloodstream. From there, the parasite travels into your liver, multiplies for a few days, and then enters your blood cells. That's when symptoms start appearing.
Now, there are several species of Plasmodium, but the most common ones affecting humans are Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi.
Out of these, Plasmodium falciparum is the most dangerous because it can lead to severe malaria, sometimes even leading to organ failure or death if untreated. Plasmodium vivax, on the other hand, is more common in India and Asia. It's less severe, but it can relapse because it can remain dormant in the liver for months.
Now let's talk about the symptoms because early detection is absolutely critical.
The most common symptom is fever, which typically comes and goes in cycles, often accompanied by chills, sweating, and intense shivering.
Along with fever, people may also experience headache, body ache, fatigue, nausea, and vomiting. Some even report loss of appetite and diarrhea.
As the infection progresses, malaria can cause anemia because the parasites destroy red blood cells, and jaundice, which gives a yellowish tinge to the skin and eyes due to liver stress.
And in severe cases, especially with Plasmodium falciparum, it can lead to cerebral malaria where the brain gets affected. This can cause confusion, seizures, or even coma. Other complications can include kidney failure, low blood sugar, or respiratory distress.
So how does one actually get malaria? The primary cause is the bite of an infected female Anopheles mosquito. These mosquitoes are usually active at night, especially around dusk and dawn.
When the mosquito bites an infected person, it takes in the parasites along with the blood. Then when it bites another person, it passes on those parasites, continuing the cycle.
Apart from mosquito bites, malaria can rarely spread through blood transfusions, organ transplants, or through sharing needles contaminated with infected blood. And yes, pregnant mothers can also sometimes pass the infection to their babies. This is called congenital malaria.
Risk factors include living or traveling in malaria endemic areas and not using mosquito protection or having a weakened immune system.
If someone has fever with chills, especially after visiting a malaria-prone area, it's important to get tested immediately.
The gold standard for testing malaria is peripheral blood smear test, where a drop of blood is examined under a microscope to look for malaria parasites. Here's a sample peripheral blood smear test report, which is also called malaria parasite test or MP test in short. And you can see over here there is 4 columns: investigation, result, reference value, and unit. Now under investigation there is two rows, sample type and then malaria parasite identification, which is the investigation that they did. And under result you can see there is under result the sample type was blood 2 ml, and malaria parasite identification you can see MP. A malaria parasite was seen in the smears that were examined, which means this is a positive report. And the turnaround time under reference value was about 1 hour. Normally it is about 1 to 3 hours.
Another very commonly used test is the rapid diagnostic test or RDT. This test detects specific antigens related to malaria parasites and gives results in 15 to 20 minutes. And here's an example of how a rapid diagnostic test report will look like. Rapid diagnostic test or RTD is also called malaria parasite card test. And remember, this is different from the one that Kshithij told, malaria parasite test or MP test. This one is malaria parasite card test. Those two are two different things. Malaria parasite card test is another name for rapid diagnostic test. And as you can see over here in this report, there are, just like how Kshithij explained, there are 4 columns: investigation, value, reference and unit. And under investigation, you can see that it is the malaria parasite card test. It has detected 2 parasites, Plasmodium falciparum as well as Plasmodium vivax. So both of those. And in the value, we can see that it is positive, meaning these 2 parasites are there and the person has malaria.
And also, if someone has malaria, then usually they will have low hemoglobin, below 12 grams, and also low platelet count, usually below 150,000. And if it's under 50,000, it can be really severe. Now, to check these parameters, you need to do the CBC test, which is also called the complete blood count test. Elevated bilirubin or liver enzymes can signal liver involvement. And to check bilirubin, you have to do the LFT, which is also called the liver function test.
These lab values help doctors assess how severe the infection is and guide proper treatment.
Now let's move on to the most important part, treatment. Malaria must be treated under a doctor's supervision.
The treatment depends on the type of Plasmodium parasite and the severity of the infection and where the infection was acquired, because drug resistance varies by the region.
Common anti-malarial medicines include chloroquine, artemisinin-based combination therapies, primaquine and mefloquine. But the dosage and the duration must be prescribed by a doctor after identifying the specific parasite.
Self-medicating or using leftover anti-malarial drugs can be dangerous. Improper or incomplete treatment can lead to relapse or drug resistance.
Supportive treatment also plays a role. Things like drinking plenty of fluids, maintaining nutrition, and managing fever with prescribed medicines.
In severe cases, hospitalization may be needed for intravenous medication, fluids, and monitoring vital organs.
Now, prevention really is the better cure here. Mosquito control and personal protection make a huge difference.
Use mosquito nets treated with insecticides, especially while sleeping, and apply mosquito repellents on exposed skin and wear long-sleeved clothes to reduce bites.
Avoid water stagnation around your home. That's where the mosquitoes breed. Clean containers. Change stored water often and use mosquito coils or vaporizers if needed.
For travelers going to malaria endemic regions, doctors might prescribe preventive anti-malarial medication beforehand. It's called chemoprophylaxis. Before we wrap up, I really want to emphasize this. Please don't rely only on what you hear online or on this podcast. If you ever have symptoms like fever, chills, or fatigue after a mosquito bite or travel, consult a qualified doctor immediately. Only a medical professional can properly diagnose malaria and decide which treatment is right for you. Every case can be different, and timely medical attention can literally save lives.
That's so true. With awareness, prevention, and early treatment, malaria can absolutely be controlled and cured.
So, that's all for today's episode on malaria. We hope you found this helpful and informative.
Don't forget to share this episode with friends or family. Spreading awareness can protect lives.
Thank you for tuning in into the Dhanvantari Podcast. Take care of your health, stay safe, and we'll see you in the next episode. Bye!